Thank you.
How's your day going?
Good, good. Yeah, working from home,
Of course, of
helping people
course.
from home. Yes, exactly. Sophie hermosa.
Hi, everybody.
Hi,
I
everybody.
see some familiar faces. Hello.
Hello, hello. So we have 10 people now. So we are going to invite them to if we are going to have a conversation today about PrEP. But before I start, we had to say some words to people. If they have a question, they can comment there at the video, and we are going to answer them right when we have the time to do that. Okay? So can we start now?
Yeah, give me 1 second.
Okay. Do you pin the
Yeah, I'm trying to do that now.
Okay, you have to put the comment in the comments.
Right.
Then when the comment come up, you have to press the comment when it's already in.
Got it. I'm like typing it right now.
Okay. You should have that ready just to paste. It's easier that way.
I know, I know.
So hi everybody. Today we are going to talk. I'm going to be with my coworker Nancy talking some topic, good topic for women's Latinx women, and we are almost about to start.
Okay, so I don't have enough room to post it, so I'm gonna post this one.
Okay. Okay. Now press it. Yeah. Okay. So can we start now?
Yeah, we can go ahead and
Okay.
start.
Okay. During the past few months, Whitman-Walker Community Health Department has expanded its outreach effort to social media platform. We cover various topics and about HIV, STI, sexual health practices, access to care, social determinants of health, and general public health intervention. For the next few weeks, join us every Wednesday um, on Instagram Live for Womxn Wednesday series. So, every Wednesday we are going to having a conversation with women. We are we discuss all the things women's health, like PrEP, women's sexual health, disparities, and access. The community health team is here to educate and support you. Okay.
Okay, so there's a few people coming on, so I'll introduce myself officially. My name is Nancy Gutierrez, and I am a community health educator at Whitman-Walker Health, and my pronouns are she, her, hers.
Yeah, and my name is Lissa Alfaro, and I'm community health as well. And my pronouns are she, her too.
All right, so just as like a little icebreaker warm up, how have you been, Lisa? What is like your new normal now that we are quarantining?
Excuse me?
What's your new normal now that we're like in quarantine, things got kind of
Yeah,
changing?
same here, working from home, doing the same as we were doing their work, but just from home. Yeah, helping people from here.
Mm-hmm.
Hmm.
Does anybody tuning in want to tell us what your new normal is? Like how you're adjusting to either working from home or just quarantine in general?
I really, like we are just, working. Yeah. So, what have you been doing all this time for the quarantine?
That's a good question. So I've just been, staying indoors, trying to keep myself sane. I don't actually like being in the house all the time. So I've been like going out for walks around my neighborhood and just trying to find ways to keep myself entertained at
Yeah,
home.
yeah, that's good. So we are close. We had to walk together.
Oh yeah, yeah. We live like down the street from each other,
Of
so
course,
we just have to, social distance.
of course. 6 feet.
Exactly.
Yeah. So we are going to start now. Can you tell us about the topic? What we are going to
Sure.
talk today?
Yeah, definitely. So today we'll be talking about PrEP for women, but specifically for Latinx women. So we'll be focusing on that population today. And so some topics that we'll be discussing regarding PrEP for women is a few facts about HIV, why women are especially at risk, what exactly PrEP is, if PrEP is for you, some barriers that Latinx women face, how we can address those barriers, and then some next steps. And I see a few folks have just come in, so thanks for joining us. Welcome to our
Yeah,
chat.
and thank you to the people who are watching us now. Let me see if we have some question now. No, we don't have a question for now. So we're going to start. And the first question is, which fact to consider about HIV exposure?
Sure. So I can definitely answer that. And also, if anyone else watching has any questions, feel free to comment your question, and either myself or Lisa will be able to answer that. So, some quick facts that you can consider according to the Kaiser Family Foundation is that women account for 19% of new HIV diagnoses in 2018. The most common age groups are between the ages of like 25 and 34, which is around 27%, or 35 through 44, which is around 24%. 85% of these cases are acquired through heterosexual sex. Latinx women account for 17% of HIV diagnosis. And in particular, for Latinx women, they have a 1 in 256 lifetime prevalence of acquiring HIV. And another thing to consider, which hits closer to home, is that in DC, the diagnosis rate is around 7 times the national rate for women. So it's a
You
lot
second?
higher. Exactly. So it's a lot higher than we can expect. And
Mm-hmm.
that's also really important to consider because DC is a tiny like city. Like we're a very small city, and the fact that we are being compared to other states, like entire states, shows how important it is that we help those right here at home.
Yeah, great information, Nancy. So, HIV diagnosis among women and girls and United States female population by race ethnicity. Can you tell us a little bit more about it?
About what?
About the HIV diagnosis among women and girls?
Sure. So, amongst women and girls, we see that the ones that are being most affected are Black and Latinx women compared to those that are identifying as either other or white. And when you think about the population in total for women, black and Latinx women are the minority, except even though we're the ones that are experiencing more of the HIV diagnosis. So that's why you see a lot of HIV prevention efforts being targeted towards those particular groups because they're the ones that can most benefit from these tools.
Yeah. Thank you, Nancy. And don't forget, people, if somebody has any question or is interested in start taking PrEP, you can call us to our number 202-939-7690. So white women are specifically in risk.
So why women are at risk, are you asking?
Mm-hmm.
Okay, so I can definitely answer that. Women are less likely to access services or information, which can be due to a number of reasons, such as poverty, cultural barriers, intimate partner violence, or putting their family needs above their own. So these are what you can consider more so like roles for women as to why they're um, facing all of these like barriers. And then for women who are experiencing intimate partner violence, which is a very unique type of barrier or risk, they are also at an increased risk for HIV and STI transmission. They're also more likely to report other risk factors for HIV. So that's that's a very special population. That's
Mm-hmm.
just important that we should reach.
Exactly.
Yeah. And another thing to consider is that we have all this information now and you see these like commercials for PrEP. I feel like we do a pretty good job of promoting PrEP services. However, in 2016, we found that only 4.7% of PrEP users are women. So
Four,
that's
4.7 is the amount is too small, right?
right, exactly. Like that's a
Yes.
number that there's a lot of potential that we could increase, and we'll kind of talk more about how exactly we can increase that number.
Good, good, good. So tell Nancy a little bit more about what is PrEP.
Okay, so PrEP stands for pre-exposure prophylaxis. It is a daily pill that's taken to prevent HIV transmission. So this is taken by someone who is HIV negative, and you're taking it before any type of possible HIV exposure to protect yourself in advance. If you take it as directed, which is every single day, it's around 92 to 99% effective in preventing HIV. And that effectiveness will depend on where exactly the exposure is on your body. So, for example, in penile tissue, it takes 7 days, which means they're taking it for 7 full days. Exactly. You're taking it for 7 days for it to be at its most effectiveness. In rectal tissue, it takes 14 days. And then in vaginal tissue, it takes 20 days.
20 days. Good, good, good. So, but you say something about we need to do HIV test before we want to start PrEP.
Yeah, so that's actually a good thing to bring up. So, like I mentioned before, you have to be HIV negative. So, how you can do that is by knowing your status. So, if you were to start the process of getting on PrEP, you would have to do an HIV test. And even if you're just thinking about it, what you can do is get tested regardless. So at Whitman-Walker, we do offer free HIV and STI testing. If you want more information on how you can get started with that, you can look down there. We have our pinned comment, which has more information on how you can contact us.
Thank you, Nancy, and great information you are giving us. Thank you for for giving us that information. So the risk factor to consider is PrEP for you.
Yeah, so PrEP is, we're talking about how beneficial it can be, but at the end of the day, it is a personal decision. So, how you can decide that for you, we can talk about a number of ways. So, these are some common risk factors that we consider when it comes to gauging whether or not PrEP is the right step for someone. So, for example, if you're not always using condoms or you're not always asking to use condoms, if you've had an STI in the past 6 months, if your HIV status isn't known of your partners, or if injection drugs are being used, or if your partners are using injection drugs, if you are HIV negative, that's also probably the biggest consideration you should take. And another thing to consider is that if you are pregnant, PrEP is safe to use and it does not increase the risk of miscarriage or birth defects. Although at the end of the day, you can definitely have that conversation with your doctor if you're still concerned about that particular risk factor.
Exactly. And don't forget the condoms are so important to everybody, right? Also,
Right.
we have to remind people that also we have access to feminine condom. If someone, someone want them, so we are maybe offering them in the future.
Right. So we
Mm-hmm.
have a plethora of free safer sex tools that you can use at Whitman-Walker. We have like our regular condoms, both regular and latex free. We do have like insertive condoms available as well, and lube to help with all of that as well.
Great, 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 great. So, Latinx Women's and PrEP. Tell us a little bit more about it.
Sure. So we've talked a lot about women in general and about the PrEP medication. So now we can focus specifically on Latinx women. So around 13% of PrEP users are Latinx. And the most common barriers that we found that prevent Latinx women from accessing PrEP are structural, community, and individual barriers. And we'll be talking more in detail about that.
Good, good, good. Thank you, Nancy. Structural barriers. Can you tell us a little bit more about it?
Sure. And just another reminder, or for those that are just now joining us, you are more than welcome to ask any questions that you have in the comments, and Lisa or I will answer them. So, starting with structural barriers, these are pretty self explanatory, like lack of health insurance, having a lack of efficient communication between the provider and the patient, low health literacy, limited English proficiency, being undocumented, having economic hardship, and also housing can all be considered structural barriers.
Good, Nancy. The next question is going to be how to addressing structural barriers.
Okay, so how we can address those structural barriers are through a variety of ways. And a lot of the things that I'll be mentioning, we already offer at Women-Walker Health. So if you're listening in and you're interested in accessing these services, you're more than welcome to come to us, since we have been able to already implement a lot of these solutions to our various barriers. So having free or low cost care using the Ryan White model, which includes mental health care, having the Gilead Patient Assistance Program to help make PrEP more affordable, dental and vision care, substance use disorder care, housing, transportation, and employment assistance, medical interpreters, peer navigation, and also U visas for victims of crime or asylum for persecuted gender minorities. These are all ways that we can address structural barriers.
Good, Nancy. So did you say something about medical interpreters?
Mm-hmm.
We are offering to people, right? They can have maybe the doctor can speak Spanish, or we can provide them medical interpreters, right?
Yeah, so at Whitman-Walker, we do offer interpretive services for variety of languages, because we don't want that to be the reason why you feel discouraged in coming in.
Exactly. Mm-hmm.
Mm-hmm.
Yeah, thank you, Nancy. And community barriers. Is there any kind of you know commercial or something to see about PrEP for women?
Yeah, that's actually a good question. So we won't see as many commercials, but we will see campaigns, like local campaigns. But just to backtrack a little, what exactly community barriers are, it's just a low awareness of what PrEP is or how to prevent HIV exposures within the community. So Lisa just mentioned having commercials or something to promote it. And so typically with commercials, we won't really see them geared towards women, because that's not the majority of PrEP users, but hopefully in the future we can see that. We are seeing local campaigns being done that are addressing women. So, for example, in New York, we have one campaign. We also have one here in DC, hashtag PrEP for her,
Mm-hmm.
to help encourage more women to be aware of PrEP.
Great information, Nancy. The next question is going to be how to addressing community barriers.
Right. So I already mentioned about having like these campaigns, but there's also things that you can do on a more like not individual, but I guess a more like organizational level. So for example, promoting clinics that are providing HIV testing, and there's a
Mm-hmm.
good number here in DC. Um, like I mentioned before, like we offer free HIV testing. So that's one place that you can go to. Creating and distributing client information or educational materials, having those ready to go for anyone to just have on their own and be able to educate themselves is a good way. Also, making sure you are hiring and training culturally competent staff, hiring and training peer navigators. Um, these two are very important because when you are a client going into a facility who's interested in something like PrEP, it's super important that you have people that understand you and are able to address all of your concerns and questions in a way that you are able to fully understand and feel comfortable with. And for peer navigators in particular, we found that this has actually been super effective in getting health information out and promoting engagement within the Latinx community.
Thank you.
Also, utilizing peer networks, support groups, and social marketing.
Great, Nancy. Great, great. Thank you for the information. And I think I missed one slide, but it's fine. So we already talked about the community campaigns that we have here in DC, which is PrEP for Her, right?
Mm-hmm.
And now we are going to talk a little bit more about individual barriers.
Okay. So I see a few comments. So JJ said it's so important to have staff who represent our communities, which 100% agree. Touch of Tule said reflecting the community that you serve, also very important. I'm sure for a lot of our clients, they feel really grateful and comfortable to see staff members that look like them, um, and being able to have that familiarity when they come into Whitman-Walker. So Lisa just asked about individual barriers, so we'll move on to that.
No,
So
sure.
for, mhm. All right, so for individual barriers, there's a few things with this one. This will be specifically for the person coming into the clinic, right?
Yeah.
So for this person, it's concerns about side effects, a hesitancy to discuss sexual health with their provider, medical mistrust, HIV stigma, discrimination,
Mm-hmm.
social rejection, isolation, depression, anxiety, alcohol, and substance abuse, acculturation challenges, and also trauma or gang violence.
Yeah. And addressing individual barriers.
Sure. So, how we can address these individual barriers is through culturally sensitive care that addresses medical needs and concerns of Latinx, LGBT, and recent immigrant populations. Also, their impact on mental health and well being. And another thing that I feel like is super important that can be looked at as not having that big of an impact, but I feel like it does,
Mm-hmm.
is registration forms that address the needs of gender and sexual minorities and concerns of undocumented immigrants. And the reason why I feel like this is super important is because when you come into a clinic or a doctor's office, what's the first thing you do? You go up to the front desk and fill out a form to register yourself as a patient or a client of theirs. And so if you're going through this form and you feel like these questions don't apply to you, or you feel like you're not fully being seen by these questions, it can discourage people to want to continue to the next step where they see a provider or some type of counselor. So I feel like that's something that we do really well at Whitman-Walker, is being able to be very open and embracing all our various identities and communities through our registration forms, where it gives a non-judgmental atmosphere.
Exactly. And So we are going to continue with, have here some more questions. Definitely in our women's of color communities. Much more important too, right?
Mm-hmm.
So we are going to talk about now a little bit what has working so far.
Okay, so we have implemented a lot of the things that I've already mentioned, and we've actually been able to kind of follow along how successful this has been with Latinx MSM community. So MSM standing for men who have sex with men. We found a few things that have been very successful with that particular community. So that includes having a provider who has the knowledge about specific medical needs
Yeah.
and concerns regarding this particular population, such
Mm-hmm.
as discrimination, social rejection, isolation, the unique challenges and trauma of the migration experience, and how that impacts their mental health and well-being. Another thing that has been successful is creating a prevention toolkit approach. So that can be having condoms available or having a partner who lives with HIV using ART. These toolkits are modified depending on that person's individual level of risk. And this can also be a perfect opportunity to include PrEP when you're discussing how you can have this toolkit together.
Exactly. Um, condom more condoms are so important, right? So now we are going to work. We are going to talk about what has working so far to continue it.
So, what has worked so far, you said?
Yeah. Next slice.
Right.
Uh-huh.
So, what has worked so far is so, like we mentioned before, this has all worked for the MSM population. So, um, I feel like these are definitely things that we can now implement among Latinx women. So we know what the unique risk factors are specifically for Latinx women, and we know what's worked so far for Latinx MSM community. So combining the two, we can create better approaches which will allow women to learn more about PrEP and also HIV prevention in general.
Great.
And I see a question. What's
What is ART?
great question. So ART stands for antiretroviral therapy. It's a mouthful, which is why we say ART. It's a lot faster. It's basically a combination of medications that HIV positive people take in order to maintain HIV and keep their viral load low.
Great. Thank you, Nancy. We are going to talk a little bit more now. How can I talk about PrEP with with my provider?
Great
What
question.
can I say to him or her? Yeah.
Exactly. So we've thrown a lot of information at everyone. So this is now like if you're interested in prepping or wondering how can I talk about this with my doctor, this is now where we'll talk about a few tips that you can use in order to start that conversation with your provider. So first thing you can do is be clear. So let your doctor know that you are interested in PrEP right away. Give all the details about your life that could be important to your health. So if your sex life is a hard topic to talk about, if you're not comfortable with doing that, mention that, let your doctor know that that's something you're not comfortable with. And that can actually spark a new conversation. Providers, I'm sure they've heard it all. They are meant to not be there to judge you. They're there to help you be your best and healthiest self. So they will do whatever it takes in order to get you to meet you halfway, right?
Right.
When you're starting that conversation, tell them about your routine. So your daily routine, especially things that might make it easy or harder to take a daily medication. So for example, if you're someone that travels a lot and isn't always at home, then that's something to consider when you're deciding to take a daily medication. Also include your health history. So that includes any past illnesses or concerns that you may have, as well as listing your current medications that you're taking, which can include supplements, vitamins, herbs, etc. And also just asking questions in general. If you don't understand anything, speak up, you know, because at the end of the day, this is a big decision you're taking for yourself. So you want to fully understand what exactly you're signing up for, what the benefits are, and also what the risks are.
Yeah, that's good information, Nancy. Thank you for giving us that great information you have for us today. Thank you to the people who is watching still us. And I have a question for you. Do I have after when I start to take a prep? Do I have to? I am going to have some like symptom or something like I mean a stomach pain, headache, or can you tell us a little bit?
Yeah, so there are some symptoms or side effects that can come along with PrEP. However, the people that experience them are in the minority. So, not everyone will experience those side effects, but if you do, that'll be typically more so like upset stomach, nausea, more so along the lines of that. And what providers have mentioned or have said that is very helpful when it comes to that is either taking it at night so you kind of sleep through those side effects, or you take it on a full stomach to help kind of alleviate irritating your stomach.
Thank you, Nancy.
Mhm.
Really, you have been giving us great information about PrEP for Latin women. And before we finish, we want to know if somebody wants to ask us something before we leave. And just I want to say, people, remind you wash your hand with soap for at least 20 seconds to practice physical distancing and keep you safe sex took it close. Yeah. Do you want to add something more?
If anyone wants to learn more about PrEP or if you have questions you're not comfortable asking on this platform, we do have like our pinned comment at the bottom that's been there for our conversation. It has our number as well as an email that you can reach us at, and you can speak to an individual about how to get started on PrEP, or if you have any more further questions, we can answer those as well.
Yeah, and don't forget to follow us on Instagram, Facebook, Twitter, and you can also visit us on our page on www.whitman-walker.org. Okay, thank you, Nancy, for great information for today.
Thank you for being here with me.
Yeah, thank you. So I hope we are going to have a new one soon.
Yes.
Yeah.
We can also go and take a walk together.
Yeah, of course. Yeah, okay. So thank you so much. Have a good afternoon.